You're listening to the Zen of Dog Ownership podcast, where we teach you everything you need to know about dog ownership. I'm your host, Turk Akbay. My goal is to bring you the best real-life knowledge to help you be the owner your dog deserves. New highly contagious dog flu is spreading like a wildfire. We first noticed this from the high number of clients saying their dogs had some sort of kennel cough they couldn't shake. Then the news came out about Charlotte having a dog flu outbreak. So we asked Dr. Stanley from Good Vets in Charlotte to help us educate our listeners and share her expertise about dog flu. Dr. Stanley received her bachelor's and DVM from Ohio State University, go Buckeyes, and she is the owner of Good Vets Charlotte. As always, all the links mentioned are in the show notes. Zen of Dog Ownership does not have any sponsors because we work for you. If you like the show, please subscribe and share. With that, here's the show. Dr. Stanley, welcome to the show. Thank you so much for making yourself available. I know these are busy times in the veterinary, and I know you are busy. So thank you so much for coming to talk to us about this ongoing outbreak in Charlotte.
No, I'm happy to be here. I appreciate you having me on, and I've been looking forward to talking to both of you about it.
All right, we're excited.
Let's dive right into it. It seems like there is some sort of a flu outbreak in Charlotte. I know a lot of, essentially all our neighbors that we come across with their dogs, I would say about 60-70% of them said they've actually dealt with this. And when I go to dog training lessons, a lot of people said, oh, my dog got it from a dog wash. I'm not exposed to anybody.
You're absolutely right. We've been getting calls daily, and it has been picking up over time as well. The last couple weeks especially, so I would say the last 2 weeks, it's been more of an issue. And the hard thing is that we don't exactly know 100% what we're dealing with. Initially, a month or two ago, when we first started seeing these cases, we were culturing, other veterinarians were culturing mycoplasma, which is a bacteria, common upper respiratory thing that happens. And then we've also been getting some positives for bordetella and also more recently influenza as well. So in general, I can't say 100% that this is influenza. It's looking more and more like that. But what we've kind of come to the conclusion of is that this is more of a canine infectious respiratory disease complex. So it could be a combination of viruses that are going around. And you're right, as you implied, that easily spreadable to others. It seems to be pretty contagious.
So is this a new disease? Like, is it some sort of combination of, because this is your field. So is it something's morphed into something new? What I'm hearing is bordetella is not really, or a shot may not be necessarily solving it, but is this something brand new, or is something that just morphed in?
It most likely is the influenza that we are getting back on our PCR tests are the strains that we have seen before. Now it's hard because you can have strains of influenza virus that mutate, and maybe we haven't been able to test for it because we don't know it's out there yet. But we have been getting positives on the two that we know most commonly, which is the avian one and the equine one. So H3N8 and H3N2. So we have been getting positives for both of those.
Interesting. And is there a lot of research done for this, like canine influenza or these other, is there a place actually that does research?
I don't know the answer to that question. I know that Cornell does a lot of testing on it. And so they have done specific, this probably won't come out right, but they have done research on the canine influenza. And I don't know the active testing that's going on, but I do know that the last few years we've been focusing more on it just because the caseload has increased.
Right. And do you think the caseload is increased because so many people are more social?
I think that it could be a really big component of it. And especially recently, I mean, you had COVID for humans. And so we didn't have a lot of disease during that time because everyone was isolating. And now that people are going back to work, they're taking their dogs to doggy daycare, they're going to dog bars after work to socialize. Right. And so our canine population is also becoming a lot more social because of that. Mm-hmm. And that's when you're going to get the transmission of disease, because these diseases are spread by several methods, but the most common one is direct contact. You also have, so nose to nose, sharing of water bowls. You also have aerosolized particles, so sneezes or coughs. I've read some reports that it can travel up to 20 feet. Wow. Even sharing or contact with infected material like leashes or collars. So the virus can stay on skin for up to 12 hours, can stay on soft substances for about 24, and hard substances for about 48. So even if they're not in the environment, right, an infected dog isn't right there in the environment, they can still come in contact with infected material.
Wow. I know we took up our dog bucket, right? Like, we have our bucket in the front of our house, and we took that up just because every dog would go by, they loved it. People, the dogs would like go towards it, but we just took it up just for safety.
Are a good place to spread disease, but you don't really think about it because you don't have it
so bad
right in front of you.
Right.
Is this only for dogs, or other animals that are experiencing this, this flu-like symptoms?
No, this specific disease is specific to dogs. Now, it did in its birth of the disease in the canine flu, it did come from an avian and an equine population first and then transferred to dogs. They have not had any instances of dogs transferring it to humans. Mm-hmm. Although it is, if you think about the symptoms, which we can talk about, it is very similar to what you feel as a human when you get the flu. So those symptoms would be fever, anorexia, you really don't want to eat that well. You're feeling really lethargic. The difference is that this new disease, which like we talked about before, isn't probably new. It can progress to pneumonia in about, I've seen studies anywhere from 5 to 20% of dogs, it can progress to pneumonia. And that can make a dog really sick and potentially be fatal. And that's the scary part about this.
Right. And are there certain dogs, whether it's aged puppies or older, or that are more susceptible, or?
Great question. And it's funny, probably 2 weeks ago, I would have said, absolutely. Our immunocompromised patients, the very young and the very old, brachycephalic, so those short-faced dogs that don't have a ton of air, their airways are narrowed, and so they don't have a lot of movement or a lot of give. If they get congested, they can get really compromised. Dogs with heart disease, they would be more at risk. But honestly, in my practice, we have seen quite a few otherwise healthy 2 to 4-year-olds that have gotten pneumonia. So that's been a little bit surprising to me that they were otherwise no other medical issues. So because of that, I would say not necessarily. I think everyone is at risk.
And is there medicine for the dogs?
Yeah. So yes, the mainstay of treatment, just like when we get the flu, is kind of those TLC things that we do. We make sure they're hydrated, make sure they're eating good food. We make sure that they're warm and comfy. We generally treat with a broad spectrum antibiotic because there are secondary bacterial infections that can occur when your immune system is fighting something else. So we treat for those secondary bacterial infections that come. And then Bordetella and Mycoplasma are both bacteria as well. So on the off chance that are those infections, we use antibiotics for those too. So our mainstay of treatment is fluids, good food, antibiotics, and if it progresses to pneumonia, then oxygen therapy as well.
Oh, how long does it take to, from my dog is sick until, my dog can go out and play? What is that, the healing process? length?
Yeah. The hard thing is that so you can have asymptomatic dogs that can be carriers, just like we thought with COVID. It can take 3 to 7 days from exposure to get clinical signs. And then that cough that is associated with this disease can last 2 weeks up to 6 weeks. And we think that they could be potentially contagious 3 to 4 weeks after the cough has subsided. And that's the hard thing, because it's really hard to tell an owner they have an otherwise happy dog that's not coughing, that normally goes to daycare a couple times a week, to not take their dog to daycare for a month. That's a hard thing to do. But it would be recommended, especially for the rest of the population, just to make sure that we're not spreading this.
That's kind of wild.
It's a long time frame. And I think that probably, generally we're saying 2 weeks minimum. I think that the 3 to 4 is being extra cautious. But in this case, when it progresses to pneumonia and can cause fatalities, which we have seen, it's worth being a little bit extra cautious.
Wow.
So your dog could be, sorry, hon. So your dog could be contagious before you know your dog is sick. And then your dog can get sick. You're like, oh, my dog is sick. And then potentially the owner is like, okay, my dog is not coughing anymore, so we're good. And then for another 3 weeks, that dog could still be infecting other dogs.
Exactly.
Wow.
Exactly, which is the tough thing, because we have had to do, when the cough lasts for a month and a half, we're doing antibiotics that whole time to cover for it. And those dogs are out of daycare or out of boarding or out of grooming for that month and a half. And then we're asking another month basically for them to be isolated as well. So it's tough on owners and it's tough on dogs too. We have to do a lot of kind of backyard play and mental stimulation to keep them occupied and mentally healthy as well.
That's very true. Very true.
We should send some training exercises to our customers so to keep their dogs occupied.
Or some mental,
free toys, the hide and seek, the, working a little bit for their food. So it takes a little bit longer. Those things we've been talking about just to keep them a little bit more occupied, but it's tough. It really is.
No, I just had a question I was thinking, like, for humans or even little kids, you can coax them as much as possible to like drink fluids. It's like, oh, you need to drink, so that you can do that with humans for the most part. But with dogs, that's really challenging. When they don't want to drink or eat, they just don't. So do you like, is it, if they really don't do it for a while, do they need to be on, or do they have to get on an IV, or like, well, how does that work? Or can you coax the dog to drink water? I don't know.
You can. I've encouraged owners to do things like add a little bit of chicken broth to the water, as long as they're changing out the water bowls consistently. You can even add a little bit of Gatorade to the water to encourage them to drink. It's not enough to like replace their electrolytes, just enough to flavor it, but that does help. But honestly, we've been hospitalizing dogs and keeping them on IV fluids for the day just to catch them up, because they're not, when you have a fever, you don't want to do much. And so they're not wanting to eat or drink. And so even a day of IV fluids makes a world of difference for a lot of dogs. I had one yesterday and we did IV, wasn't eating. We did IV fluids, sent him home, and I checked in this morning, we're eating again. So, and that brought down the fever as well, which is really nice. So we started off with a fever of 105. And then this morning her temperature was 101, which is normal. So, and that was with antibiotics and fluids. We don't generally give, when you get a fever, you can take a fever reducer. We don't generally do that for our dogs in our hospital. We do fluids and kind of supportive care because I don't know exactly what we're dealing with. And so those medications don't come without side effects. So we want to be careful with them. So but fluids did the trick. And she's doing a lot today, which is great to hear.
That is really good to hear. I did wonder too, are there at-home electrolytes that you can give your dog?
There aren't any on the market that I am familiar with. I'm sure there are some out there. Electrolytes in general aren't normally needed. I mean, when we give fluids, we give either a fluid called LRS or sodium chloride. But the main thing is actual fluid intake. It's not so much the electrolyte increase that they have to worry about unless the dog is very, very sick or there's something else going on.
Okay. One other question I wondered is just about, are there supplements or like vitamins that dogs should be taking that are healthy right now that would be helpful, just like for us humans?
In general, the main thing that I make sure that all of my clients and patients are all of my patients are on is a high quality food. And that's the thing that's going to fill all of the needs for the patient, because there are foods out there that are not nutritionally balanced. And then my answer would be, yes, those dogs need a multivitamin. But if you're on a high quality food that is nutritionally balanced, and I'll say AAFCO certified, so that's AAFCO, that means that the food has been proven to be balanced and meet all of the vitamins and minerals that a dog needs on a daily basis. And that goes for senior dogs. There's difference for senior dogs versus puppies versus adult maintenance. So they don't necessarily need anything additional to that as long as their food meets those requirements.
So one of our neighbors who was walking her dog, and it was like green. It almost looked like the dog had highlighter, like almost like a glow in the dark green stuff. And she's like, oh, it's like he's not feeling good. And I said, I can tell. And what I heard you say earlier is it's probably, even when we're walking our dog, just for preventive purposes, not let dogs meet for a little bit, which is kind of an odd thing. But how can we, like, if somebody looks at a dog, I know if the dog is non-showing, then you wouldn't know. But, is there some telltale sign for us to like, hey, we're not going to meet that dog today, like by looking at it? And for humans too. Oh, another thought, if I pet a dog that's contagious and then I pet another dog, am I a carrier for that?
So I'll answer the first question first. The main signs that I would watch for, it's hard because we're also getting we're getting out of fall into winter a little bit, but some of the signs that I would watch for are similar to allergies. So mucoid nasal discharge is one of those things. And you talk about that green nasal discharge, that's absolutely something that we're seeing a lot of in our respiratory disease patients. The difference to me is that the production of it in the respiratory disease patients is a lot more than what I'm seeing that would be with allergy patients. And typically allergy patients, you're not seeing as much, or as it's more of a clear. It's not as much of a green. It may be a clear or a white. Whereas with the respiratory, it's more of that green, yellowy. So that I would watch out for sure, but it could be confusing if that dog has a lot of allergies and just has a lot of nasal secretions. That goes along with eye secretions as well. So you can have that with allergies. You can have that with this respiratory disease. I think the difference here, and it may not be easy for the normal person to tell, but the difference is the amount. So if you have a long snot booger dripping out of the dog's nose, I would stay away from that dog for sure, especially if they're coughing on top of that, but coughing can be seen with allergies. So I would err on the side of caution in general in this next month period, and just kind of avoid all dogs that you see any discharge from or coughing. To answer your second question about transmission, we have been very, very cautious in the veterinary clinic in our hospital about transmission, because yes, we can absolutely, as people, transmit this disease as well. Now, hand sanitizer should fix it. So you wash hands in between each patient. But if you touch a patient's back that has no nasal secretions on it, no fluid, it's dry, technically you should not be able to transfer it to another dog. But the likelihood that dog sneezed in its own vicinity and then landed nasal secretions on its back, and then you pet it and then transfer, yes. That dog could lick its paw or lick its back and then get it into its nasal or respiratory system pretty easily. So if all things were perfect, then no. But the likelihood that it's actually in their environment and on their body is pretty high. So yes, the answer is yes, we can easily do that. And even on collars and leashes too, when we're touching those.
I never pet a dog on the back. I'm usually up their face. I go,
yeah, well,
this is the best.
And even more so.
Oh, you're going to have to carry your own hand sanitizer, honey.
Yes.
Yeah. We've been wearing, I mean, when we get these dogs in the clinic, we are having them call before they come. We're taking them in the side door. Every single one of our respiratory dogs goes in the same room. We are bleaching in between those dogs with 10-minute contact time. And then we are wearing PPE essentially when we're handling those dogs in clinic. So we put on shoe covers, we put on our surgery gowns and gloves. And then they get their own thermometer for the day, they get their own stethoscope, all of that stuff stays with them. And then we clean it all afterwards at the end of the day. And we're using a bleach mixture for that.
Wow.
So that means you're probably out of room for new patients.
We have been really lucky. We've been hospitalizing maybe one a week. And we have an area that we can isolate dogs. So we have runs that we can close the cage and then a door that is separate from our treatment area. A lot of clinics and hospitals don't have that luxury that we have. And so they're having to refer those cases to the emergency clinics. But I do know that the emergency hospitals are getting a fair share of these cases that are getting really sick. So when I called last time, we work with Veterinary Emergency Group over in Sharon Woods and by the mall. And I called to transfer a patient and she said, make sure they come pretty fast because we're getting filled up. So that's another scary thing is that we're losing those dogs that need oxygen therapy. We are running out of room for them.
Mm-hmm.
This kind of reminds of March 2020 for humans almost.
Exactly.
So
yep.
When should someone say, like, can someone be at home and say, yep, my dog has this based on if they listen to this and not come to vet, or does every dog that shows these symptoms really need to go to vet? When should they come to you?
I just like it with COVID and people, you kind of self-assess. And then if it gets really bad where things are progressing, then we sought, human healthcare. And that's what I'm going to recommend for my canine patients as well. Because every dog that comes through my hospital that is contagious, that is spreading the disease, potentially could be spreading the disease. So if they're not super sick, this can potentially resolve at home. Knowing that if the dog stops eating, if the dog has a cough that is getting worse, if you feel like the dog is super lethargic, those are all things that I would want to see them for. If you're cavalier at home, you could also take the dog's temperature. The most accurate way to do that is rectally. And so a lot of owners don't want to do that. But certainly if the dog had a fever as well, which would be classified as anything above 102.5, that would warrant a visit. Because what we want to do is make sure that this hasn't progressed to pneumonia in those dogs. But otherwise, if they're still eating, if they're acting normally, if they are just have a cough at home, then that could self-resolve in about 2 weeks, which is what we had normally seen with all of our upper respiratory cases before this whole thing started.
Wow. So we really need people, dog owners, to be responsible for, as far as not letting them go to daycare or meet and greet, out right. and about. Yeah.
I really have been proud of the Charlotte community, though, about getting the word out there, because I've seen several news articles on it. I've seen a lot on Instagram, and I have seen some messages coming out from those daycare and boarding facilities saying, hey, this is going around. You can still board with us, but know it's a risk. We're going to make sure everyone's updated on vaccines. And so I think that everyone is doing a good job. We could always do more, obviously, but we're trying our best and doing a good job about getting the word out there and trying to collectively make this thing go away
right.
for the betterment of our canine populations. Because as you guys know, Charlotte is a huge dog city, which is awesome. And I love that.
Right.
But it also means that it's really hard to get these things under control because everyone wants to be out with their dog.
Absolutely. Absolutely. That's really good to hear. And you said vaccine. Is there a vaccine for this is there a vaccine?
There is a flu vaccine, and there is a difference between a bivalent and just only covering for one strand. So I'm recommending the bivalent vaccine, which that's the H3N2 that I talked about before, and the H3N8, that's a combination vaccine. So if you haven't already gotten it, and your dog is social or at risk, the heart disease, the brachycephalics, the dogs that go to daycare or dog bars or dog shows, those would all be dogs that I would consider, and I would highly recommend getting this vaccine. The other one would be Bordetella, just to make sure that we're up to date on that vaccine as well. Now, both of those vaccines don't prevent the disease 100%. It's kind of like the flu shot every year for humans. We do our best, but what happens generally is that they can still catch it. It just lessens the clinical signs. So we found that it has been helpful in these cases, even if dogs are getting sick. It is better than the dogs that are not vaccinated.
Wow. And this is, I'm kind of going back, but I wondered, so we work with a lot of different apartments and communities, and I wonder if there's anything to tell them, should they take away their dog bowls and ask people not to congregate? Is there anything that those communities can do?
I would absolutely recommend that for now. And I hate to even say that because I'm such a big proponent of, dog socialization in the right environments, right, and, all of that kind of stuff. And even for people too, it's such a good way for them to commingle. But in this instance, I would try and avoid sharing elevators with other dogs, maybe take the stairs.
True, I didn't think about that. Yeah.
Yeah. And try and avoid the doggy parks that they have at each facility. And I would avoid letting my dog drink from any communal bowls right now as well. Mm-hmm. So those kind of things, just kind of isolating your dog. And it doesn't mean you can't socialize, but it would just have social distancing, right? We talked about that with COVID, and this would apply in this instance.
So I know my neighbor, I have two neighbors on each side. Let's say they have dogs. And then they don't go to doggy daycare. Are they safe? Can they just kind of like a designated play date?
I had this discussion yesterday with a puppy owner because we have a lot of discussions about socialization with our puppies. And I encourage them, if the dog is at home by themselves, they don't go anywhere besides a veterinary clinic, and they're up to date on their vaccines, I do want those dogs socializing. The risk of those dogs having the disease is so low, and socialization in our puppies and dogs in general is so important that I do think that would be completely fine. As long as you know that they haven't had exposure to, and you can't know for sure, right? I understand that there's limitations to that, but if they aren't taking their dog out and meeting other dogs, and it's kind of you and them together, I think that would be totally fine. And I would encourage it too, because we don't do well with separation, and I don't think our dogs do either.
Right. Yeah. I'm often paranoid, but paranoids don't get hurt. But what I'm hearing you is that veil of protection is pierced when one of those dogs go to a doggy daycare, or they're exposed to something, then they're exposing the neighbor's dogs too. Is that
Correct.
True?
Yep, that's exactly right. Just because this thing has been so contagious, and the virus, especially influenza, can last on surfaces for so long. So I think that you just compound your risk when you are out in those environments.
Got it. And so let's talk a little bit about prevention then. I know we were for me, it's as soon as, it's easier. I think it is easier to prevent if we can, although it seems like this will take a lot of work on the human's part, but I think it still is cheaper and more effective than getting my dog sick and then deal with what may or may not happen after that. So is there some things that, wash your hands, drink salty water, gargle, and what do you recommend? How do you prevent this?
Turk, if you could get my dogs to drink salty water and spit it out, I think you'd make a lot of money. That would be awesome. Although for people, I've heard that works. So I think the biggest thing to prevent and keep our dogs healthy is just mitigating risk. So decreased exposure risk and keeping them up to date on vaccines. And I think that's what it's going to come down to with this disease. We will get through it. I hope it's hard because winter is coming, but that brings everyone inside even more. But those two things should help us get through this.
Is this only in Charlotte, or is this a nationwide? I mean, I know we think it's in Charlotte, but what's happening? Do you know?
I have also heard of it increasing in Dallas as well. As an isolate. And this did happen about 5 years ago, and Charlotte wasn't hit too bad, but it's not the case this year. But yes, I've also heard of it in Charlotte. I haven't heard of it happening in other cities, like you expect, like Chicago or something like that. But Dallas has been in the news lately too.
Texas, right?
Correct.
Because there's Dallas, North Carolina, which I didn't know. If we keep this on the podcast, I want to make sure. I know Dallas is in Texas, but
well, and you have Denver, and there's Denver, North Carolina, and then Denver, Colorado. So it's always good to clarify.
Well, this has been really helpful.
Yeah, I don't mean to be all gloom and doom and be such a downer, but because majority of dogs will fully recover, right? It's just that those can progress to pneumonia, but you don't want to be that owner of that dog that it progresses to. And we want to do our part, obviously, to keep everyone else safe.
Right. Absolutely.
Is there, limiting the exposure is, like you said, keep your dog in, or at least have, set friends, close friends that they could play, and then occupy them until Christmas.
Yeah, I mean, until foreseeable future, until we see these cases start to go down, because I can tell you, when I look at my schedule at the veterinary hospital and I see that there's 4 coughing dogs in the afternoon, until I start seeing that number decrease, I'm not going to change my recommendations, because it only has been increasing, unfortunately, the past 2 weeks.
Wow. And is there a place to get reliable information? Like, is it something that you post on Instagram, or is there a site to go to for people to go, oh, the cases are getting less?
That is a great question. And there is, you can look at the Department of Agriculture. The North Carolina Veterinary Medical Association is also a good resource. We actually reached out to them at our clinic, and it's hard because them getting all of this information from different sources takes some time. And so they don't have a ton of updated information right now. I'm sure in a couple months they will, but to have information that is really, really up to date is hard to come by, because we're all just kind of talking about it and collecting data right now. So no, I think that talking to your specific veterinarian is the best resource right now to see how it's truly impacting where you're living.
Really, I know we're here to just be more informational and just to share what's going on, but not to scare people, but just to make people aware of what's happening. Just so people can make their best choice.
Because if you're not on the social media, or you've missed the news article, you may not know. And as much as we can get the information out there on different platforms, it'll be helpful. So I'm glad we had the opportunity to do this.
Yeah, this has been great.
Is this an expensive treatment?
It's a good question, because it depends. If you have a dog that we can treat patients on an outpatient basis, say they just need antibiotics, then it could be, less, not expensive. It's all relative, right? But I would say less than $200. If they require hospitalization on IV fluids for the day with injectable antibiotics because they're not eating well, then at our hospital, it could get up to the $700-800s. If you are referred to the emergency clinic to spend time on some oxygen, then it can get up into the thousands. So it depends on the level of severity for your specific pet.
Yeah. Keep your dogs healthy.
But you're right, Eric. Prevention is key, because, you think about other diseases, it's way more expensive to treat than it is to prevent, which is the whole reason why we recommend prevention for heartworm, flea, and tick, those kind of things, because you can get diseases from all of those. But prevention may seem expensive, but it's way cheaper than if your dog truly gets the disease. So even if you have a dog that is fully vaccinated, you can still carry the disease. You can still contract the disease. You can still spread the disease. So I 100% recommend vaccinations, but it's not an iron shield to prevent this thing 100%, or else we wouldn't have this issue in the first place.
Yeah, this must be scary for, doggy daycares, because essentially it's like I heard some of the places, they just said, sorry, we're closed for next few weeks. I think, financially that's a big hit, but I think for the prevention of spread of this in a long term, it's definitely, it sounds like you'd have to do it.
It pains me to make those recommendations because I love supporting those facilities, not only because the people there care about animals, but it's also good for our pet population. No dog wants to sit at home for 8 hours while their human is working. And so going to daycare is like the best thing. But and the unfortunate thing is the timing too, with the holidays coming up, because it's a busy time for those daycares and boarding facility. And it doesn't mean that they can't have people there. It's just that I would recommend, they isolate someone that is coughing right away and make sure that they can get them sent home. So in case of emergency, they have a place to put them and get them back to their humans as quickly as possible. And then obviously make sure that we're up to date on vaccines, because like we talked about, it's not 100%, but it's sure going to help to have those vaccines on board. It is tough though to, as someone in the animal profession, to make recommendations to not go to those places. But I feel like we at least need to decrease the load there. So whoever doesn't need to 100% take advantage of those services, if you can swing it, have someone come over to your house to take care of your pets over the holidays, that would be ideal.
Dr. Stanley, thanks so much for your time.
Thank you.
How do people reach you if they have questions, or let's plug you in? Thank you so much for your time.
I appreciate you guys so much and the platform to be able to speak about this. We have a clinic Instagram, is Good Vets Charlotte. We have a Facebook page, which is Good Vets Montfort. And then you could call our clinic anytime to talk about this more, or if you're concerned about your dog, you could call and schedule an appointment as well. Our phone number is 704-924-4700.
Well, yeah, this has been great. I really appreciate you taking the time to chat with us.
Yeah, it was super fun. I hope it turns out well. And I'm happy because I feel like we got a lot of good information out there. Like I hit all the points that I wanted to talk about, which is awesome.
Perfect.
Thank you so much. I'm Turkak Bay. That's my wife, Jill, and that's Dr. Stanley from Good Vets. Thanks so much. Have a nice day, everyone.